Acting as the command center for the central nervous system, the human brain enables thoughts, memory, movement, and emotions. As such, maintaining a healthy brain during one's life is the highest goal in pursuing health and longevity.
Brain health is key. Our brain is responsible for everything from walking to thinking. And as we get older, our brains tend to change and limit those functions. It's very hard to check brain health. You typically need long tests that are done by specialists. So the average doctor who does a routine checkup really is not capable of doing it. And also, doctors are so busy that it's just something that they don't ask about.
Most diagnostics for measuring physical brain health are invasive and expensive. In addition, some cognitive assessments used by doctors lack sensitivity to subtle changes, can be time-consuming, and are not scalable.
To evaluate brain health well, you need a neuropsychologist that gives a long battery of tests that could take several hours, and it's a specialty that people usually don't take advantage of unless someone's really showing that they have a real problem.
In the cardiology field and in general in medicine, we're always focusing on the anatomical problem. But one of the things that we started to realize is the impact of cognitive disorders in actually well-being and outcomes in patients that actually undergo different type of procedures. So one of the things is in modern medicine, we cannot really decouple the anatomical aspects, the anatomical challenges, fixing those problems, and the overall outcome of what actually we do. Because the connection between cognitive performance and actually clinical success in anything that actually we do, pharmacological, genetical, or interventional, is absolutely linked together.
As technology gets smarter, more precise functional assessments have the potential to improve patient outcomes for the growing number of neurological and mental health issues.
We're always actually thinking about the anatomical issues. What do we need to fix? But the big question right now is, what is the right patient to treat? Because the outcome depends a lot on the cognitive capacity the patient has to receive, accept, and evolve after therapy. So for us in our field, to be able to understand the real cognitive status of the patient is extremely important, is becoming extremely relevant.
ViewMind aims to be the most precise technology in the world for measuring brain function, the command and control center of the human body.
Digital technologies hold the potential to assess the brain with better accuracy and efficiency in a less invasive manner than previous screening tests like MRIs and PET scans.
The eye is the window to the brain, and ViewMind's technology analyzes eye movements using machine learning and artificial intelligence, and is able to infer the preservation of different cognitive functions with this approach. Brief cognitive assessments that a doctor might perform can be insensitive to subtle changes, and a more comprehensive battery that a neuropsychologist would undertake can be very time-consuming. Our technology has the potential to measure very subtle changes repeatably, and this can provide a significant advancement in being able to measure the impact of treatment and the progression of disease.
Born out of decades of research on how ocular movements correlate to different brain functions, the comprehensive assessment tool has the potential to alter the way brain health is monitored, diagnosed, and assessed.
It's until now that we have the technology to be able to discriminate those things that we were not able to unveil, which is eye movement, anatomy, physiology through the eye, is going to become an extremely powerful tool for us to be able to really understand not only the anatomical aspects of it, but the functional aspects of it. What is the real cognitive status of a patient, and being able to discriminate the patients that could benefit from certain therapies from patients that actually perhaps we should be more conservative as well.
Well, digital tools don't require an expert to administer them, and digital tools can focus in on very specific aspects of brain function that are important so that they can be done regularly, earlier on, and can catch problems way before they become serious.
As a direct pathway to the brain, tracking eye movements can provide direct access to more timely and more accurate monitoring of brain health.
If subtle changes in brain health can be measured, you would have a tool that can monitor the health status of the brain over the human lifespan. Brain health reflects the overall health of a person. I can see a future when not only do we measure temperature, pulse, the blood pressure and various other metrics, but we also have regular brain health checkups. The future of brain health is prevention.
In the future, the ability to monitor the impact of treatment will enable proactive, preventive brain health checkups, and the possibility to develop drugs that can target diseases earlier before irreversible damage has occurred.
Right now, the typical doctor doesn't even ask about brain health unless someone is older and starting to complain. Using digital tools, one could monitor brain health from a young age and really catch people when things are starting to change and when there's more of a chance to do something about it.
We want to understand more about the patient's mind, even if we're talking about the intervention of structural problems in the patient. Because one of the things that is interesting right now is we can identify anatomical problems, structural problems, but we don't understand well what is the real candidate, the true candidate to actually some therapies. The term of utility, or actually trying to treat and implement therapies for the right patient, is becoming the most important aspect of what we call personalized medicine. And the only way to be able to tailor the therapy to the right patient is being able to understand the holistic status of the patient through mind status, cognitive behavior, and actually physical performance of this patient. So this type of technologies are going to revolutionize the way we treat patients in the future.